Hello, good morning, everyone. Thank you for taking time to join us here this morning, and welcome to IMU Postgraduate Info Week for Master of Counselling Program. I'm the moderator for today's session. My name is Chen Wei. I'm an alumni of IMU Bachelor of Science in Psychology and currently pursuing my Master of Counselling in IMU. So before we begin, I would like to address a few housekeeping rules. We have muted microphones for all the attendees, and if you have any questions, kindly use the Q&A chat box and we will address your questions at the end of the session. And please take note that this session will be recorded. And I'm very honored to introduce you our speaker today, Dr. Nicole Chen, the Program Director of IMU Master of Counselling Program, to speak on a collaborative practice, the roles of counselor in a multidisciplinary team. So Dr. Nicole has been working as a counselor and trainer since 2001 and has served in different counseling settings in non-governmental organizations, educational institutions, and private counseling centers. She's also a registered counselor under the Board of Counsellor of Malaysia. She has wide counseling experiences in dealing with family, couples, and even clients with who experience trauma. So as I mentioned earlier, she's currently the Program Director of Master of Counselling and a Senior Lecturer at IMU and has more than 12 years of tertiary teaching experiences. She has published a number of journal articles and has presented at both national and international conferences. She has been invited by local and international journal publications as a research paper reviewer for research papers in the field of psychology and qualitative research. Her current research interests are in human resilience, psychological healing, couple and family therapy, and women issues. And she is also an active executive committee member of Malaysian Marriage and Family Therapy Association, MyMFT. So before I pass the floor over to Dr. Nicole, a gentle reminder again that kindly drop your questions in the Q&A chat box at the bottom of your Zoom window, and we'll address your question at the end of the session. So without further ado, I will now pass the floor over to Dr. Nicole. Thank you.
Thank you so much, Chen Wei, for the introduction. And very proud to say also Chen Wei is also currently our master student, and she's doing really, really well in her program. We can see her potential as a counselor. Okay, so I'm going to share my slide. Okay, everyone can see my slide, right? Okay, all right. Thanks again, Chen Wei. Okay, so today's our topic is on cooperative practice, the role of counselor in a multidisciplinary team. This is a topic that I decided to share because it's also kind of like letting you to know the important and crucial aspect, yeah, as a counselor serving in a multidisciplinary team, what to expect. I think it's important, especially for those who are actually pursuing counseling or for those actually who are interested to pursue into counseling. I want you to know how crucial it is for a counselor in play their role actually in facilitating cooperative practice. So let me share a little bit background about counseling field in Malaysia. Have been a very challenging years for all of us as a mental health professionals or practitioners. Why? Because if I compare 20 years ago and today, of course I can see awareness is increased and many people start, to reaching out to help from professionals, especially counselors, clinical psychologists and psychiatrists. And very, very happy with the progress. But we also see the trends of competition between these mental health professionals and sometimes can cause a lot of tension in working with each other. So therefore today I want to talk about if you would like to work and serve the counselor, it's very crucial for you to kind of preparing yourself to be able to work with multidisciplinary. Because I think this is the way to go. We no longer can say this case only handled by counselor, or this case only handled by psychologist, or this case only handled by psychiatric. It have to come together as a team. So therefore today I want to take opportunity to introduce this concept with all of you. Yeah, and so if you plan to pursue Master of Counseling, it's very important for you to look for program that facilitate this form of learning. If not, you'll be struggle, to able to survive many contact. So it's also something I highlight a lot in all my master counseling students to them that It's so crucial for us to preparing ourselves to able to serve a multidisciplinary team. And because by the end of the day, always remember, this is what I always say to my student or the people that I work with, or even with my peer. Client win is not the counselors or not the psychologists. All the parties should be given what the clients want, what the patient want, not the counselors, not the psychologists, not the psychiatric. So you have to come together. Okay. All right. So start for today's session. Let you know a little bit information. There's many past study actually done about why it's so important to have counselor to play and understand the multidisciplinary role, especially come into collaborative practice. So today I wanted to take opportunity to help you to understand what is cooperative practice, because this is crucial for you to understand. Is something that you needed to practice, you need to facilitate when come into working setting in future. You plan to become a counselor. And also past study have shows a lot that interdisciplinary cooperation is perceived by counsel educator is a best practice strategy for addressing some of the nation critical issues, yeah, or social issue. And why? Because as I mentioned to you, for some cases, we needed to a team of mental health professional. It's not just a counsel job to manage. So therefore, the counsel needed to be comfortable to able to work with, yeah, different helping profession, different mental health professional, even able to work with medical practitioners as well. So it did not just limit into mental health profession. But of course, working closely with mental health professional is something very crucial, because you will have to work with them, because the natures of some cases require a teamwork, yeah, among the mental health professional. Okay. Especially, I think COVID-19 crises have really put a big impact to all people, included not just in Malaysia, but nationally as well, globally, have been very challenging. And we also see the past 1 years, many people and past study have reported an increase of mental health services required. Supposedly during MCO, we should be, as a counselor, I should be a little bit more free because you can't go to work, right? Unfortunately, not say unfortunately, I would say that, but due to this crisis, it was so overwhelming by many people. It created a lot of anxiety and worry and depression. And actually, a lot of counselor, clinical psychologists, and even psychiatric are filling up with cases during this MCO, yeah, during the critical time for all of us, because people find very challenging to just stay at home without a social contact. And I'll not be surprised that there are many suicidal cases. So therefore, you can see, no matter what state and what circumstances, counselor always play a significant role as well in provide support. Okay, and cooperating between disciplines highlight as a key effective delivery of service across broad spectrum of community mental health. So one aspect that I also needed to let you know in terms of community mental health service, um, you know, s- um, it's so crucial for us to work as a team, because different natures of certain cases, it really require the attention for all. Example, I just put, if I'm going to have a child who is suicidal, yeah, and parent came to seek help, so I will have to work closely with the psychiatric as well the clinical psychologist to do assessment, as well to do support or even medication to help this child or this young person. But for family, it's very challenging to accept the fact that actually their children is not well, especially mentally. So for me as a counselor, I play become a very crucial role to prepare the family what to expect and how to support. Therefore, I love the aspect of provide family therapy and couple therapy to help the family, to help the client. So my role is not just helping the client who are suffering with mental health issue, but I also create a system as a counselor, yeah, create a system that are safe, that allow client or patient to be buffer on. So therefore, our role as a counselor become very crucial to work closely with clinical psychologists as well as psychiatric to be able to provide the best service for the people needed. because without counselor come in to provide support needed to help the family understanding the natures of what's going on, chances are high parents may scared to let the children take medication and refuse to be compliant about the treatment, and end up the child will go through this what we call yo-yo, up and down process. And that's why it's so important when we work as a team, the client will get the best service because we're able to prepare the whole system to provide the support needed to even help the family. Sometimes it depends major job of the counselor. If there's need for me to call a school to able to create a support, I will go to that extent to able to reaching out to school to provide support needed for my client. Okay. So now I'll talk about what is collaborative practice. So you'll be very curious about it. So why is this so important and why it's so special for us to understand this particular concept? As I mentioned, it's crucial, and having consistent in past study indicated it's so crucial to play this role, to have counselors who are trained to understand the importance of cooperative practice and know how to apply cooperative practice in working with multidisciplinary team. Okay, so what it means here is basically it's a mental health provider from different professional background work together with the patient, family, carer, and communicate to deliver the highest qualities of care. It allows mental health provider to engage any individuals whose skill can help and achieve local mentors and help goal. So here look into the symbols I created, kind of like an image to help to understand what's involving in cooperative practice. So as a counselor, I do work with psychologists, and I do work with social worker, I work with healthcare providers, and I work with psychiatric as well. If for some cases, example, if I came across case that are eating disorder, and I know it's pretty serious, and I take eating disorder cases pretty seriously, yeah, because it involving mortality is pretty high if we discover someone who are serious experiencing eating disorder. And I can't send this particular patient to hospital without healthcare provider help. So I do work with a general practitioner to explain suspecting this particular patient is having eating disorders, and I needed his help to able to come up with a letter, yeah, and of course you also do an overall checking in medical and consistent whatever that I'm assessing, and from there I will ask the medical or GP or general practitioner can usually maybe take a look at this case and then quickly come up with a letter to send this young lady or young man to hospital because it's pretty serious. And the general practitioner will work closely with me and understand why I quite concerned. Therefore, he quickly come up with a letter to send this particular patient or client to hospital. So you see, I work with medical practitioner who are able to provide support. And one this particular patient, um, eating disorder patient, go all the way to the hospital setting. So chances are high they will be approaching a clinical psychologist, even sometimes with psychiatric, depend what type of mental health issue that can occur and experiencing by this particular patient. Okay, and that's where all the other mental health professionals start coming in. Yeah, and some cases we may involve social worker. It depends on the natures of the case. Yeah, and in this setup for serving mental health professional, in serving patients who are suffering with eating disorder, I may involve dietitian in as well. You can see how the whole system is needed to support this particular patient. Yeah, it's not just a counselor role to do it, but it involving the whole system. So now I have a psychologist able to do confirming the assessment. I have the psychiatric may able to provide medication to help, especially when client going to depression or anxiety. And I have dietitian come in to help and provide support, guiding the family as well this young person who's suffering with eating disorder, what are the proper diet. So it works as a team. And that's why it's so crucial for us to understand the important working as a team and come into part of the mental health practitioners or professional. Okay, why is so important incorporating cooperative practice in our system, especially provide support? Okay, So here I indicated mental health professional, sometimes I call MHP. So when you see the word MHP, mean mental health professional, which included psychologists, counselors, marriage and family therapists, involved as well the psychiatric. Sometimes I even involve, yeah, if I do, I can even involve, family medicine specialists, because they also very much familiar the important to work as a system. Okay, mental health professionals are bounded in the system, and why it's so crucial for you to understand you cannot run away. Yeah, have that perspective. How I'm a counselor, I just do whatever I want. I can, but no, we are all coming and bounded in the system, and the system are connected to each other. You cannot cutting off the client or the patient connections with the other system, which is very selfish if any mental health professional doing that, because our responsible is to make sure the quality care. Can you picture if a GP decided not to refer you to a cardiologist, refuse to refer you to a orthopedic, when you do have a bone condition? Can you picture that a GP refused to refer you to see a gynecologist when you have a condition that needs a specialist? So it's the same concept. It didn't make sense when someone have to take care of everything. So you have to connect to each other and provide support to each other to make the best service for our client, for our patient. Okay, so the effective CP here stands for cooperative practice. Okay, enable MHP to deliver high quality, safe, person-centered services to achieve the best possible individual mental health outcome. So who's most important? The patient, the client. So whatever that I can create a system, a supportive system for her or him to recovering, that will be my priority. Therefore, as a counselor, we highlight a lot in terms of working as a part of multidisciplinary team. So this aspect that's very crucial. So some of the benefit, yeah, that if you're going to facilitate cooperative practice with, yeah, cooperative practice when you serve in mental what we call multidisciplinary team. So the first thing that highlighted here, improve patient client care and outcome. So rather than two different profession coming together and questioning each other. New pictures that, or if I'm counselor, I try to provide the support to the family, and then a medical doctor come here and question me, what are you doing here? And you should not be involved here. So can you picture how complicated thing can be? Yeah. So therefore, we try not to let this thing happen. So it's very important for us to come together and understand each other to be able to provide the best care for the patient. Minimizing error in assessment, intervention, and treatment. Yeah, especially come into assessment or diagnosis and related to mental health. It's so crucial to have another person to also do a similar assessment to confirming the diagnosis. So there are a lot of clinical psychologists that I work with. Yeah, yes, they are very well trained in diagnosis and assessment compared with counselor. Okay, for counselor, we are very good in dealing in relationship, adjustment issue, managing stressor to buffers our client out from the mental health condition. So when the whole three person come together to provide support, so can you see that I refer to clinical psychology for further assessment, and the clinical psychologist come up with the assessment, and then she or he will start to check with the psychiatric what his or her thought about the assessment. And the psychiatrist will come back and confirm, yeah, I think the diagnosis is pretty clear. Seems this particular patient is suffering with depression or suffering with anxiety. So there's a lot of consistency take place because you have another expert come in to confirm. And that's where minimizing the error of assessment. New pictures you being diagnosed as depression and then later another's mental health professional giving you a medication for anxiety. So this is become very complicated. Therefore, working as a team is very crucial. Okay, potential reduced cost of treatments as well, because we do came across story. Some mental health professionals, it can be clinical psychologist, it can be counselor. They wanted to keep the patient for themselves, so they refuse to refer the case for the others people, and that end up this particular patient may stay with someone or a mental health professional for years, that there's no improvement, due to they refuse to work with the counselors or clinical staff, refuse to work with the other team members. And that leading clients have to spend tons of money for 1-2 years without a proper treatment. So therefore, it's very crucial to understand when we work as a CP, together to facilitate CP, cooperative practice, we actually have increase chances for the potentially reducing the cost of treatment and strengthening the working relationship among MHP. So I think this is aspect also very crucial. Okay, however, so I also want to share with you some of the challenge we face as well as a counselor, and especially come into trying to facilitate or implementing cooperative practice, because it's something still quite new in the field and not many people yet comfortable to facilitate this. But in IMU, we believe this, and this not just apply in training counselor, it's apply also in involving training nurses, medical doctors, pharmacists, and others mental health professional or medical professional and healthcare professional. IMU stand is the same. We believe in working as a team and provide the best service to our patient. The first one of the challenge that often experience is lack of trust and cooperation among MHP peer, mental health peer. So we do came across experience. I personally also came across experience when I wanted to work as a team and people would question, do Nicole are capable, are competent to provide such support because she is not a clinical psychologist. So therefore, sometimes the lack of trust also can be challenging, and you have to work extra hard to able to build that trust. Second challenge that we may face to facilitate this is attempt to play multiple roles. So this is a very common story we have in the field of counseling and the field of mental health. It's pretty sad, sad reality, because they wanted to so-called keep their income or increase their income. They start to play multiple roles. So you are trained as counselor, but you also try to attempt to become clinical psychologist to do assessment. And with some training, you also try to become marriage and family therapist. And then later, you play also your counselor role. Serving different population, it will needed different set skill. So therefore, you can't say that, oh, I'm trained a counselor, I will able to taking care of all these cases, unless the program that you are actually provide you some form of training, allow you to able to facilitate that. Example, for IMU Master of Counseling program, we actually have few elective modules that students can take in marriage and family therapy. So this group of students who graduated from our program, they were able, to conduct session with couples and family due to some of the training that we intensive to provide that support. So it's very crucial for you to also be aware, work closely with different mental health professionals to provide support needed rather than keep all this income for yourself. Okay, inaccurate perception toward other mental health profession is also very challenging. Due to the training natures itself quite different. Like example, for clinical psychologist, psychiatric, as well counselor, the training nature a little bit different. Though we actually learn quite similar stuff, but of course, psychiatric be different because they have to have a bachelor's in medicine, and after that they have to pursue into a master in psychological medicine. So the training will be focused a lot into medication diagnosis. And this part is not provided at all in training of clinical psychologists as well, counselor. So I want you to be aware about it. The difference between the clinical psychologist and counselor. Clinical psychologists are very well trained in assessment and diagnosis, and the counselor play a lot crucial role in help understanding relationship issue and help people adjust better. So what happens is when we have this all different background training in terms of the way the nature of the training come together, you may realize they speak language that are not something they're familiar with. So therefore it causes a lot of anxiety. Can I work with a counselor if she don't understand what and I say? DBT, and what we call dialectical behavior therapy. And because this training normally is trained in clinical psychology. So this kind of thing that is a challenge as well we have to face when implementing cooperative practice. Different professionals and cultural practices often lead to misunderstanding. Now, very similar in this aspect. Yeah, sometimes misunderstanding can create it due to the training itself is very different. For example, for me, if I work with a client or family, I'll look into the aspect of relationship between my client with the whole family system. What causes my client have this particular condition? And I try to work in the perspective of systemic. But if I'm going to have a counselor, even a clinical psychologist, who train only very much one-to-one session, they may find difficult to understand what I try to say. And they may thought that I may not competent to do it. So this part that's very tricky. So it's very important for us to prepare ourselves. So these are challenges that you may face and provide support needed, yeah, to able to facilitate cooperative practice and provide the best support for our patient. Okay, just remember, if you do have question, go to the Q&A section. Yeah, key in your question. All right. So we will try our best to answer all your question. Yeah. Hope to get to know some of your perspective, some of your question in mind. So feel free to go into the Q&A session. All right. Okay. So how to start? So this is something that I will train the counselors that working with me, or to train my student to understand how to go about to facilitate their cooperative practice. Okay, the first one here will be cultivate a systemic perspective in your practice. We find what is this systemic perspective? Systemic perspective basically is to able to see a problem in the system manner. Yeah, so mean that when there is this problem, I cannot see only this problem because of one patient problem. Yeah, I have to see what's going on that facilitate causes this problem. Okay, example, I have a child who came to see me, referred by the family, refused to go to school. Yeah, and then maybe a child who are just 6 years old, and then the parent tried to ask the child, and the child just refused to tell what's going on, and then just couldn't verbalize it what's going on, and the family become very distressed and don't know what to do, and they seek help. Okay, so when seek help, I will bring this family and the child to my counseling therapy room and to understand what's going on. Is there something happening in the family causes the child behave that way? If I check it out, yeah, there is something, yeah, but I can rectify it very fast by working closely with the parent. But I realized that after in this session, the child also experienced a lot of bully, yeah, in school, and therefore I will be working closely with the parent and even working closely with the school to able to look into this matter in the systemic way. So mean that I don't just see the child and I just ask the child to change the behavior and therefore the child will be recovered. No such thing. Especially when you're involving a situation where the child can be very powerless and helpless. So therefore now I work with the school. Yeah. An example, the child now, to the extent that anxiety is so bad, refuse to go to school, got nightmare, So I may have to work with medical healthcare professional to provide support to the child. Yeah. So all these things come in place. That's why you have to able to see a problem, yeah, in a systemic way, because it's all linked and connected. I may able to help the child to reduce the anxiety to the family. But if the child constantly facing bullying, and therefore I will have to addressing this aspect as well. Of course, this is only counselor who understand systemic perspective. They will put in effort to go into the system to solve the issue together with the other team member. Yeah, so that's why systemic perspective is one of the very crucial aspect. Number two, willingness to walk alongside to negotiated dialogue. There's a lot of time my peer will say to me, Nicole, so difficult, as a counselor, try to work with psychiatric and psychologists. They try to question my capability, my competency. Be honest, I also experience challenge as well. Yeah, though I have many years of experience, but I do realize it. It's a part of parcel journey to able to facilitate this. Yeah, because you needed to able to get your peer get to know you better. Therefore, you needed to able to negotiate dialogue with your peer. Yeah, nothing just come and take place right in front of you. It need a lot of effort for us as a counselor to reaching out to them. Number three, importance of maintaining human relationship. Yeah, mention client is the best interest, as I mentioned here. Yeah, we have to have a good relationship with peer that we good with. Don't try to question and try to feeling insecure. Yeah, working closely with them. Put relationship as the most important aspect because that will help our client have a best service. Continue to navigate relationship and service. Focus on the best interest of your client and patient. So we cannot avoid not working with people because working with people will give your client best interest, the best service. So few skill you needed to learn to become a counselor, yeah, to able to work in multidisciplinary team. First, work in a setting that facilitate cooperative practice. So a setting that believe on this concept. If not, it's a bit difficult to facilitate this. Number two, skill for working with patient and client to able to assure your client, yeah, how to go about to work, yeah, and trust them, convince them they're able to work with different people. Because we do came across story, client just, Nicole, I just want to work with you. I don't work with other people. So it can be quite scary for some clients. So you have to have skill set to able to prepare and we needed to work with other people as well. Yeah, skill for cooperating with healthcare mental health provider. This is also one aspect. Try to understand, the problem was based on the medical perspective. Because that's where we can reaching out to healthcare and mental health provider. And one very crucial aspect is acknowledging the overlapping role, okay, between helping profession. So this is a quick model to help you to understand how overlapping cases can take place in provide support needed to patient. Okay, acknowledging the overlapping roles and duty among example, we talk about psychiatric counselors as well clinical psychologists. So this is what I like to use it as a guide to explain to my students or even peer what are the things that we needed to able to see and how is the time for able to refer cases. Okay, so few aspects, yeah, intervention and treatment. Counseling refer to brief treatment compared with the others. Clinical psychologists and psychiatric often they will use a treatment that involving long term approaches used. Counsel often very similar. We actually use a lot of approaches that are very similar. So you came across cognitive behavior therapy, the psychiatric you get to familiar what is cognitive behavior therapy, and you get to understand your peer of clinical psychologists who are familiar with cognitive behavior therapy. So approaches that actually we also learn in our classes as a counselor. Yeah, so it's a lot overlapping. Assessment. All three also do assessment, but the intensity of cases will be a little bit different. So this is the mental health continuum help us to make sense. Yeah. Counselor often serving in this group of population. They are healthy, highly functioning, but somehow experiencing stresses in life. Example, changing job, new baby coming in, got into relationship, got married, moving to a family that they are not familiar with. So a lot of adjusting issue and can be very stressful. So our role as a counselor, we provide support to this group of people. So what our role to do is to buffer them, protect them, not to go into this category of injured and ill. Yeah. So when a patient go into injured and ill, such as start to have mentally breakdown, start to hear voices, start to went into depression, couldn't sleep, couldn't eat, and that's where I will involving my peer clinical psychologists come in to do assessment, yeah, diagnosis, and they may even come out with treatment that are very suitable for this group of clients who may need a little bit more long-term treatment. And for clients who are already suffering with mental illnesses, they are considered what we call low functioning or less functioning in terms of ability in our daily routine. For example, they couldn't sleep, they couldn't eat, they couldn't go to work. So counseling method may not useful. So that's where clinical psychologists come in to provide very specific behavior intervention. Psychiatric will come in to provide support for medication. And after this client feeling much better after the medication, after the psychotherapy, and that's where they can come back to see us again for support. Yeah, example, or they have some stress relationship, so that's where they can come. So it's not mean that counsel when you refer to psychiatric, the case will be never come back to us. So it have to continue because it depends the need of the client or patient. Okay, so very quickly, this comes to my last slide about what make IMU a special program in terms of Master of Counseling program. Because first, we actually have very experienced lecturer, and all these lecturers are very much believe uh, the understanding of cooperative practice, because we are aware working as a team is the best way to give client the best treatment. Yeah, most of our peer and faculty lecturer have at least 10-year working experience. Okay, offer specialties training. This is another unique part of our program. Actually can go into marriage and family counseling, crisis and drama counseling, as well as expressive art. Community exposure is one also another unique point of our program, where you're able to participate a lot of community project as well. And the last part is lady platform to practice, where within this platform that when you come into study in IMU for Master of Counseling program, our aim is to be able to facilitate this IMU Psychology and Counseling Learning Center to be also a multidisciplinary team coming together. So you'll be supervised by counselor, also supervising by clinical psychologists. If possible, I'll be involving psychiatric as well. And that's how unique our program is. Okay, very fast come to my personal sharing experience in working as a team, yeah, together with a multidisciplinary team. I'm actually very blessed. I have opportunity to work with different peer. I start my career as a counselor very much early, and I start working relationship with clinical psychologists. And I have this peer of mine. She remembers her. I'm very grateful of her. Friends of mine who passed away a few years ago. She's a clinical psychologist, so she taught me so much about working with clinical psychologists, and it was very nice. That's where my first exposure, yeah, in terms of working with different multidisciplinary team. And I find very powerful because I learned so much from clinical psychologists when the way how they see the problem. And when I'm able to see the way how they see the problem and then make the whole discussion, the dialogue, the best interest of the client come and take place, because you're able to see their perspective. And I'm also feeling very blessed because currently I'm also practicing in IMU Healthcare Center. It's also a center, a setting that believe in cooperative practice, because we work together as a team. Yeah, so there's no saying that the GP will not refer any cases to psychologists, will not refer the cases to the counselor. It works as a team if they do see, yeah, there's a need to refer the case, and they realize that medication, they may discover that some cases, it seems this patient keep coming back for medical treatment, but he or she is not recovering. And then that's where they look into, something not right. And that's where they will call me and contact me. Maybe Nicole, you wanted to talk to this patient to see what support needed. So I do find myself also create a bridging, yeah, when sometimes when client or patient very scared to see a psychiatric, because there's always have this sort of negative perspective toward medication. So therefore, allow us to able to kind of like link client to a proper treatment, proper service. I think this is something very crucial as well. So if a patient came to me are suffering with mental illnesses, and they find very difficult to seek help because they're so scared to see a psychiatric. So I play that role to help them to understand what is this treatment from clinical psychologist, and what treatment that she will receive from a psychiatric, and clear the myth. Sometimes a lot of these are perspective, or if I take medication, I'm going to depend on medication, addicted on medication. There's so much fear. So as a counselor, I also create a bridge, yeah, to link my client to appropriate services as well. Okay, and so far I really embrace this experience working with different peers, and I attend training together with them, get to understand their language, and I attend a lot of training. And also very nice to see a lot of my peers, for example, psychiatric as well, clinical psychologists start coming together, attend training together. So we start to see the perspective of coming together to provide the best support for the client patient start to take place, and I'm very happy with the progress. So I just want you to know, if you're pursuing a master counseling program and you choose a place that allow you to learn about cooperative practice, good. If not, if you're still considering pursuing the master counseling program, that's where you can consider, IMU master counseling program, and come, get to know more about this program and chat with us, and then from there we can provide more understanding. Okay, thank you so much for your attention. Yeah, I think we have few questions. So I will back to Chen Wei. Thanks.
So thank you, Dr. Teo, for this very informative sharing section. So there are two questions here from the audience. So move with the first one. So the first question is, a lot of Malaysians think mental health issues are not to be talked about. It's a taboo topic. And how do you encourage people to go to seek help?
Okay, thank you so much for the question. Definitely is one of the very challenging issue that we face. Yeah. I still remember my personal encounter many years ago when I was working as a social worker come counselor. I got to know one case that I handled. I was very pretty sure this particular client needed psychiatric treatment. And I actually negotiating with the NGO saying that, hey, this person needed to send to see a psychiatric. And they were all laughing at me at that time, saying that, what you talk about? No, she's just lazy. But they didn't realize that depression can facilitating people who lack of motivation, and they cause them don't want to do anything. They just want to sleep and sleep. But due to lacking of what we call mental health literacy, yeah, therefore at that time it was so difficult for me to even work with other people to provide support needed. Yeah, and I remember I received a lot of rejection. But the good news here is, yeah, now things have changed. If you really look into now, I start to see family members are much more open for support. So what I try to say here, it will be still a challenge for us to face in terms of people still think that it's a taboo subject. And I do came across young people, Nicole, I cannot tell my parents about that I'm seeing you. You know why? Because they will ask, why I have to see a counselor? What's wrong with you? So I think this type of topic still come out a lot. But I would say that everyone play a part. Yeah. So it have shown a great improvement compared to 20 years ago. But I think we continue facilitate that. So like today you attend today's session, you can play that role as well. Nothing shame. Yeah, to seek help from mental health professional. Yeah. So I would say that how do you encourage? I would say this statement. If you do came across your peer who need help, so this will be my suggestion for you. You say to them, seeking help is not something shame, but seeking help it involves your courage. So for you, letting yourself to have this courage to seek help is something that you should proud of. So this is something that you may consider to say it. And often when I use this approach, it helps a lot to giving a lot of affirmation and assurance for someone to seek help. So hopefully I answer your question. Thanks.
Thank you, Dr. Nicole. And I do agree this is something that we all can start from ourselves and we share with our peers. So there are another three questions that are relevant to our program. And I'll go one by one. So the first is, how can I join the counseling program? Is working experience important?
Okay, thanks for this question. It seems like we are very much interested to the counseling program. Actually, we do have this online meet the faculty, and that's where you're able to get a lot of information about the program itself. So what I'll do is later I'll ask my organizer to send you the link. So later you can register for the session. Okay, so you asked me about whether working experience is important. I will say it's not just about limited to working experience, it's also about life experience. Because therefore sometimes we encourage, one thing that I like and I appreciate a field of counseling, the more life experiences you have, the much more easy for you to able to understanding the concept that you can learn in Master of Counseling program. Yeah, because life experiences giving you a lot of sense of maturity about life. So when you come in pursuit of Master of Counseling program, your work experience will be very much great advantage. Your life experiences also very much great advantage. And some people may ask me, Nicole, I came from very damaged childhood. That possible for me to study Master of Counseling. But are you well now? If you are well now, why not? Because one thing very beautiful about counseling field is you came from a very hurtful background, example, childhood that very difficult, but it also give you a lot of sense of understanding how difficult for people in terms of life suffering. So it helped you to able to connect with people even better. So therefore, work experience definitely helpful. Life experience is also very helpful, and do not feel shame if you do came from a condition or situation or the past that are very hurtful. Because I came across a lot of counselor who also I call as a healer. So they actually went through a lot in their life and they become counselor, they become healer for the others. So that's beautiful things about counseling program. Okay, thanks.
Thank you, Dr. Nicole. So another question will be, how long is this program? Can take part-time or full-time?
Okay. So the next question here is whether that actually is can full-time or part-time, right? Okay.
Mm.
We have these two options. So you have can offer a part-time program, you can offer a full-time program. Part-time program will involve 4 years, and full-time program will involve 2 years. So for the 2 years program, currently Chen Wei is in 2 years program. Chen Wei let you know it's pretty intensive, and later I'll let Chen Wei to share her experience. But if you feel like you are not rushing to become a counselor, and you still feeling very comfortable what you're working, but you would like to prepare yourself to change your career to become a counselor, I would say that go for part-time. So because that part-time will giving you a little bit more time to really learn about the concept of counseling and give you kind of like almost like 4 years journey to really shape the identity of a counselor. So by the end of the day, after 4 years, you feel a little bit more solid serving as a counselor. Maybe Cherry want to share some of your experience as a full-time student. Yeah.
So I'm currently a full-time student from Master of Counselling, and I'm currently in my semester 2. So yeah, I do agree it can be quite intense when it comes to workloads because we have to complete everything within 2 years. But what I think the most important is the support from the lecturer and peers really play a big part to like everyone will journey together and make this journey very meaningful. So this is my experience so far. Like I really see the importance of having support from lecturer and peers. Like it's very, very important.
Thanks, Cherry, for sharing. It's true. We are like a small family coming together, and I like the part Cherry say it's a journey. Yeah, we don't just train students because it's part of the program we want to train you, but it's also our responsible to journey with you to become a counselor. So by the end of the day, you become a counselor that you'll be proud of, and I'll be also proud of you. So that's something that we our philosophy and principle in training counselor. Okay, thanks.
Thank you, Dr. Nicole. So another question I think is maybe due to this pandemic. So there's this question is, are classes now online or face-to-face?
Okay, can understand. Okay, for us, our program quite unique in the way that even before the pandemic, we already designed this program in the way it's partially online and partially face to face. So currently the structure is basically you're going to have online classes in the weekend, sorry, weekdays. The weekdays classes will normally fall into 7 p.m. to 9 p.m. Okay, so it's after working hours. So you will no need to just come home and then you can be comfortable at home and set up your laptop and you start to attend classes, online classes between 7 p.m. to 9 p.m. That will be your weekdays. And come the weekend, the expectation is come for face-to-face classes. And why we still persistent to have face-to-face classes, it's not something we want, but of course, something we want as well, because first, to train a counselor, we need you to be present physically to really understand the skill set needed to become a counselor. Same principles, like if you're going to train a medical doctor, are you going to be feeling safe to train a medical doctor online? If you don't we trust a medical doctor can be trained just online. Same thing, the principle apply to training the counselor. So we don't believe training online will help the counselor become a good counselor or effective counselor. You need a lot of processing work, being there, really understand, support like what Chen is saying from the lecturer, from the peer, and get to understand yourself better. That make the whole experience become very different. Yeah, and of course, another aspect is also compulsory expectation from the board of counselor. They only allow 30% most of the subject that compulsory subject required by the board of counselor. You have only allowed to conduct 30% online, 70% have to be face to face. So that's the reason why we're using this method, but we design in the way that it's easy to easy for working adult because you no need to rush to come to uni in the weekdays. you only just come once a week. Yeah. Sometimes it's need come twice a week, especially on the weekend. But it's a little bit more feasible now for the working adult. Thanks.
Thank you, Dr. Nicole. So we have two more questions regarding the program, then we will move on to the next one. So the next one will be, is there a need for me to get counseling experience during the program? Any field trips?
Okay. There's no expectation for you before one. There's no expectation for you to have counseling experience because we are enroll the student, so the student will able to understand skill set needed to be trained, yeah, to the counselor, so therefore they can become counselor. So don't worry about you have to have counseling experiences. Whether that there is a field trip, we do have some plan, but it's not easy to facilitate field trip now due to SOP required. But what we do a lot is we facilitate a lot of this online learning with different multidisciplinary teams. So, like example, I think January we have conducted a session where we involving psychologists and clinical psychologists or counseling psychologists come from NGO who serve mental health community, yeah, community mental health service, yeah. So that what we do, it enhance your understanding what is needed to be done in the field of counseling. Okay, so we do have field trip, maybe not really implement it now due to limitation, but it's more into a lot of exposure to online with different people background, and therefore you can enhance your learning as a counselor. Okay, thanks.
Okay, thank you, Dr. Nicole.
Mm.
So the last question regarding the program is it possible for me to work and study full-time?
Yes, definitely. I think we do have numbers of our students currently study full time and then work at the same time. But I think it'll be very crucial for you to really plan your time well. Yeah. But you have to prepare yourself and come into semester 3 where you're doing your practicum. You may have to really do a lot of negotiation with your boss because you're involving a lot of collecting hours. Because semester 3 is where you collect a lot of practical hours. And when you fulfill the practical hours, only that we place you into your attachment, where you're able to serve as a trainee counselor to provide support to the community service. So I would say time management is very crucial. A lot of negotiation, discussion with your boss is also very crucial. Hopefully your boss is supportive. And then generally, most of our students, if they do have all these things, they generally quite okay. Yeah. So who can't, they will let me know. So that's where they will change their study mode. But for this, I think so far, most of the students doing full-time are pretty consistent and persistent to complete their program within 2 years. Thanks.
Okay, thank you, Dr. Nicole. So we move on to the next question. So what happens when there is a language barrier between counselor and client? Is language proficiency isn't up to par?
Okay. I would say it very much depend how comfortable you are. For example, you are very comfortable speaking English. Chances are high you will be serving English educated people. So that's where your population that you'll be serving will be those who are English ed, who comfortable to speak English with you. Yeah. But you feel, oh, Nicole, I wanted to able to serve a lot of people. For example, you feel like you need to serve those who are poor, underprivileged. So you may have to consider to really enhance your language competency according to the need of the society. Example, you may have to speak Bahasa Melayu well. So therefore you are able to reaching out to those who are underprivileged. Or, because Bahasa Melayu is one of our language that the whole generally the Malaysian learn. So and this language you're able to reaching out to many, many different race. So I would say that's something you wanted to consider. But if you do have additional language competency, I also can speak Japan, I can also speak Korean. Wonderful. Because for our field of counseling, we are very much lacking of counselors who have multi competency in terms of their language. So I would say to you, it's something we encourage to make sure that you have strong capacity, competency in one language. But we are highly encouraged to have at least two, three language competency because it will be great advantage. Yeah, because if you plan to serve in Chinese community, you make sure that you're able to be familiar with the natures of Chinese language competency because certain term and keyword sound so powerful when you speak in Chinese. Yeah, so I would say it's very much back to you to decide which population you want to serve, and that's why you do the planning accordingly. Thanks.
Thank you, Dr. Nicole. So the next question will be, how popular is online counseling locally these days in our community? And is this approach recognized by the Counselor Board?
You might see do some research in regard to this online thing. Okay, here have been a tricky situation for this online counseling. In Malaysia contact of the Board of Counselor perspective or stand, if you are a licensed counselor, there's no objection for you to provide online support to your client. But Board of Counselors still very careful in terms of the term use or keyword use in terms of the services. Because according to Malaysia contact, in the law perspective, we cannot simply claim that I provide online counseling because there's no prominent or aspect that allow us to claim this that we're able to qualify to do online counseling in the legal perspective. And Board of Counsel by now they call as a psychological support, yeah, as a online services, online psychology support. So most of the peer who follow strictly what Board of Counsel say so, they do provide counseling services, but the term used we call as a psychology support. Yeah, how popular? I would say yes, it have been increased popular the past 1 year due to the limitation they're unable to come for the face-to-face. But among our peer, we also very careful to take in online cases because it involve a lot of risk. If the case that we're going to face is someone who are suicidal or high risk in hurting themselves, so for such cases, normally we need to do a quick assessment first before we decided to just say, oh, okay, take this particular client for online session. Like me, I work with couples and family, so I'm very careful. I don't simply take in cases for online. It's because when couples who are high intensity in conflict, it will be challenging for me just to facilitate it online. So therefore, a lot of my peer, we will propose first session, we go to face first, and after we see whether that is safe to do online, and if safe to do online, we were able to follow up with online session. If not, we will prefer face to face. And like me, I do see my client face to face because I work in healthcare. Healthcare clinic would not close and MCO because part of compulsory to open to provide support to the people. So I do see, but we make sure that we follow SOP expected from the government so that safety take place. So it's been become very popular the past 1 year. Okay.
Thank you, Dr. Nicole. So we have this one last question. So how do you see the future of a career as a counselor?
Okay. Okay. I think I have shared with students. If you really wanted to do a comparison here, in Malaysia context, opportunity in mental health field, actually is very high for counselor because due to the natures of counseling roles start to recognized by the Malaysia government. So therefore, you start to see the expectation from all the government setting, included government ministry, included school, colleges, university. There's a compulsory to have counselor. So if you ask me, job opportunity is still there. It's very much high demand. Yeah, but it's back to you to ask yourself which field or which area of population that you would like to tap on. Like example, I came across a lot of counsel currently serving in private school. Okay, and private school actually needed a lot of support because especially school that involving what we call hostel, young student, they have to be in there and their families away, and then the support is needed for the student counselor. And there's a lot of counselors actually currently serving as a counselor. So I would say career opportunity is great. It's back to you to decide what are the area. If you find that yourself are very much interested into corporate work, so I do see a lot of our peer who go into corporate work, human resources, consultant company to become counselor as well. So I cannot tell you the moment you get it, you're able to get job, but I'm quite confident you're able to secure job within a short period of time if you are not selective in the field you wanted to choose. So I would say that reality opportunity for career as a counselor is much more greater compared with others helping profession, due to have a expectation from the government to have a compulsory registered counsellor to serve in the setting. So therefore, it's much more greater compared with others. But I do not know 5 years and 10 years from now, we may foresee more others' career will come in, depend the need and demands of the need of the country. Okay. Thank you so much for all the questions. Okay. Chen Wei, anything you would like to add regard to, in terms of your, for today's learning session, or you as well your own study experience about, working in a multidisciplinary team and cooperative practice concept that you learned?
So there's this something I learned recently during one of the sharing session, is where about ethical and legal issues in serving as a mental health practitioner, which include like psychology officer from D11 from the police, and defense lawyer. So actually, I would like to invite Dr. Nicole to share some of your experience working with people in a like legal background. Yeah, because like
Okay.
during this session, we have heard like collaborative practice with clinical psychologists, psychiatrists, and healthcare profession. So I'd like to hear your sharing with how about the legal people? Mm.
Okay, it's true. Another thing that I very drawn into my attention is working with people with very strong background with law. Why? Because it's part and parcel of our career pathway also to working closely with legal officers or lawyers, because a lot of job nature sometimes may involving cases that, example, child abuse, sexual abuse, domestic violence. So something that you can't avoid not to work with. So my experience work with D11, like example what Chairman, D11 basically is a special unit section under the police, the larger Malaysia, or the lawyer force police, yeah. So this particular section is doing investigation that's specifically related to abuse, domestic violence. Yeah. So there's a group of police officers and there's a group of counselors who are actually serving with this particular unit to provide support needed. And why they need very specially trained group of counselor to be able to provide support needed to this group of victim of abuse, because it involves a lot of legal aspect and implication if the support given is not strong. So therefore, I'm actually very glad to know that government also very much aware it's so crucial to have such unit specific to provide support needed. So my experience work with psychology officer under this D11. I'm very impressed by them because they really know the law and they are very familiar how to prepare documentation. Because when you go to the court to testifying on behalf of your client, it's not an easy process, yeah, because you're being questioned. So are you really just a counselor? So how many years experience you have in this A approach, B approach? And are you really sure that whatever you do, whatever you say that is the answer? So that type of experience I have not, yeah, came across. I have not been testified, but I heard a lot of my peer told me that when they are involving such cases, they really being grilled in the court, really badly grilled. They felt so bad, and therefore it's so important for you to understand why it's so important to able to work with different peer who are also served in this particular section, because it helps you to able to link your client with this support. So rather than you become a person to testify, yeah, because you are not familiar with the court, you are not familiar with the system, and you do not know what are the law that actually related to this particular case. So I will work with the 11 counselor, and then the D11 counselor will provide support needed and collect the evidence that needed, and they will able to bring this case to the court. Yeah, and they have really well trained what to do, what to write. So there's another aspect that you see, it's not just working with clinical psychologists and psychiatric, but there's many other people we needed to work with to provide the best support needed. Okay, there's so much more to share, so much more to learn, and it's something that I find very, very fascinating as a counselor. Though I worked for 20 years, I still feel so much for me to learn. Yeah. Okay. Thank you so much, Chen Wei, for the question.
Thank you, Dr. Nicole. So thank you for all the questions from the audience, and also thank you for all your time today, spending like your Sunday morning with us. Really appreciate that. And it comes to the end of the session, and like we'll hope to see you all in high view. Yeah. So thank you, Dr. Nicole, for the sharing today. So that's all for today. Thank you. Bye bye.
Thank you so much for Chen Wei. Okay, thank you everyone. Have a good Sundays ahead. Yeah. Thank you so much spending this morning with us. And thank for the organizers, Atia as well Chiu Yong for organizing this event. Okay, have a good day ahead. Okay, bye bye
Bye.
everyone.